At Yashoda Hospital, Secunderabad, we are organizing a live workshop tomorrow on minimal access cardiac surgery. For a long time, people have been undergoing open heart surgery through a breast splitting incision on the front of the chest, about 20 to 25 centimeters in length. And after that, they have a lot of pain, they take some time to recover. No doubt, the cardiac surgery has become safe, about 97-98% safe these days. However, patients still continue to struggle with pain, with some infections, requiring a lot of blood transfusions, and need to take about 2 to 3 months rest before they can go back to the work. This is making some people avoid surgery even though it is life-saving for them. And many patients, even after a few years, come back and say, Dr. Gokhale, I have done my surgery, I'm alive, but still I have these problems. See, as we know, as the technology is improving, we want to make the life of people better and better. As part of it, at Yashoda Hospital, Secunderabad, we acquired some experience on minimal access cardiac surgery. We brought all the technology required for it so that we can offer what is good for the patient in a much faster way. Here we have been doing significant number of minimal access cardiac surgery. We have one of the largest experience in the country, in India. We have done over 300 operations so far. The success rate is more than 98%. You have to remember at this stage, we can't offer this to everyone. But as it's evolving, today we are able to offer this to more and more patients who require open heart surgery. For example, those who require single valve replacement, open heart surgery, we can offer 80 to 90% of the people this operation with a small incision below the nipple, about 5 to 7 centimeters incision. They go back to work in 3 weeks' time and get discharged in about 3 to 4 days' time. Similarly, for bypass surgery, we are able to do whether 2 grafts, 3 grafts, or 4 grafts through a small incision on the left side of the chest, and people go back to work in 3 weeks' time, but which has not been happening for a long time. Patients have been extremely happy and they are thankful to us that we are able to bring this. And we have been conducting this workshop last 3 years to enable more surgeons learn this so that more and more patients get benefited. In fact, this year we are getting about 150 surgeons from all over the country, from USA, from Singapore, from Sri Lanka, and we are all going to have a debate. We are going to show them how to do bypass surgery and a valve replacement, and then we'll have a discussion about various the pros, cons, how to make things better. And I expect after this, more and more surgeons in this country will learn and more patients will get benefited. That is our aim, so that to train more and more surgeons. Heart disease have become rampant in our country, and previously bypass surgeries were common in people more than 60 years of age. But today, about 40% of the work we are doing between the age of 45 to 65. And it's not like this in developed countries. That is because heart problems have become very common and more people are developing heart attacks in an early stage. And once we do surgery for them at an early stage, and especially bypass surgery, many of these patients are likely to come back after a few years, 10 years, 15 years, for a second operation, third operation, like that. So to avoid this, best thing is to prevent heart problems. But of course, if we get a heart problem, today we can offer this minimal access surgery to many of these patients. And in future, if they require second operation, then we can go through this front. Or maybe we'll develop some technology, new stents, etc. to prevent all these things. Because once we do surgery on the front, to go for a second operation is very difficult. But if we do through this minimal access surgery, second time you can go through the front, it makes second operation safer and easier for us also. And like this at Yashoda Hospital, Secunderabad, we are working on bringing new technology to make life good for the patients so that they recover faster. Similar way, as you know, we are the pioneers in transplantations. In our state of Andhra Pradesh, we are the only hospital where we can offer heart as well as the lung transplantations. And in a country, if you take, there are only 2 hospitals or 3 hospitals which can offer transplantations like us. So we are happy that the Yashoda management is supporting us to bring newer technology so that we can do better things to the patients. They recover faster with less pain and they live longer. We have done little over 300 operations so far. We have done bypass surgeries, valve replacements, and we have closed the holes in the heart. These are the common operations which we do. We are getting 150 surgeons. We are getting one surgeon, Dr. Jayaraman from Chicago. We are getting Dr. Kofidis from Singapore. We are getting 2 surgeons from Sri Lanka and about 130, 140 surgeons from our country, all over. From all the big organizations, from Narayana Hrudayalaya, from Apollo, from NIMS, all the places people are participating. Because this is about heart surgery tomorrow.